In this nursing mindset video, we'll discuss fluid balance. Today, I want to share one question that I hope you'll carry with you throughout nursing school and into practice. When you're caring for a patient with fluid imbalance, don't start by just memorizing signs and symptoms. Pause and ask yourself, where's the fluid? That one question can help you make sense of your assessment findings, laboratory values, and ultimately determine your priority nursing actions. So let's go ahead and take a look at this graphic. Let's start on the left side. This patient has fluid volume deficit, meaning there simply isn't enough fluid circulating through the blood vessels. Now think about what happens because of that. If there's less circulating volume, blood pressure begins to fall, the heart tries to compensate by beating faster, and the kidneys work hard to conserve every drop of water they can. Suddenly, those assessment findings aren't random anymore, they're all connected. The same thing happens with the laboratory values. Instead of just memorizing which labs increase, recognize the pattern. With less fluid in the bloodstream, the blood becomes more concentrated. That's what we call hemoconcentration. That's why you'll see laboratory values like BUN, hemoglobin, hematocrit, and urine-specific gravity all increase. Rather than just memorizing 4 different lab values, remember one idea. Less water equals hemoconcentration. Now, let's move to the center of the graphic. This is probably the concept that challenges students the most. Sometimes the body hasn't lost fluid at all. Instead, the fluid has moved to where it's not useful. This is what we call third spacing. Fluid leaves the blood vessels and collects in places where it doesn't help circulation, like the tissues, the abdomen, or even around the lungs. So here's the question. If the patient has fluid, why might they still show signs of fluid volume deficit? Well, that's because the fluid isn't where the body needs it. It's trapped somewhere else. That's why a patient with severe edema or ascites may actually have decreased circulating volume. I want you to remember the clinical pearl on this graphic. Swollen does not always mean well hydrated. That's a huge nursing mindset shift. As nurses, we don't just look at what we can see, we think about what's happening inside the body. Now, let's look at the opposite problem. With fluid volume excess, there's too much fluid circulating in the body. Eventually, that extra fluid begins showing up in places we can assess. So patients gain weight, their ankles swell, they may develop crackles because fluid is collecting in the lungs. You may even notice distended neck veins because the circulatory system is overloaded. Again, don't just memorize each assessment finding. Ask yourself, what are all these findings trying to tell me? They're all pointing to the same problem, too much fluid. The laboratory values follow that same pattern. Instead of becoming concentrated, the blood becomes more diluted. This is what we call hemodilution. Extra plasma dilutes many of the blood components, so laboratory values like the BUN, hemoglobin, hematocrit, and urine-specific gravity all decrease. Again, don't just memorize the list, remember the pattern. More water equals hemodilution. Now, let's take a look at the bottom of the graphic. Whenever you assess a patient with possible fluid imbalance, I want you to mentally walk through these questions. First, where's the fluid? Is there too little, maybe too much, or has it shifted somewhere it doesn't belong? Next, ask yourself, what evidence supports my conclusion? What do the vital signs tell me? What do laboratory values tell me? What am I seeing during my physical assessment? Then determine your priority. Does this patient need fluids? Do they need excess fluid removed? Or do I need to address the underlying cause that's causing the fluid to shift? Finally, evaluate if your interventions helped to meet the patient's goals. Is the patient improving? Has urine output changed? Has the weight changed? Are the lungs clearer? Are the laboratory values moving back towards normal? That's clinical judgment. I'd like to leave you with one final thought. As you move through nursing school, you'll care for patients with heart failure, burns, kidney disease, liver disease, electrolyte imbalances, and many other conditions that affect fluid balance. Although the diagnosis will change, the nursing mindset stays the same. Don't start by trying to just memorize each disease process. Start by asking yourself, where's the fluid? If you can answer that question, you'll begin recognizing patterns instead of just memorizing lists. You'll understand why laboratory values change through hemoconcentration and hemodilution. You'll recognize why a swollen patient may actually have decreased circulating volume. And most importantly, you'll be able to prioritize nursing actions that your patients need. That's the nursing mindset. Keep developing yours.